Hello, hope you are fine. Always prevention is better than cure. So there is some statistic in the Children Rehabilitation Center that talk about the number of the patient that have some disease. It's gonna increase. So what is the cause of increasing those disease? A disease like slow physical development, like plagiocephaly, and another disease is hypoplastic bone of the hip. So why the number of this disease always increasing? Today I'll talk about one of the main reasons that we can decrease those disease and we can prevent it. How? By a simple way, which is we can do it when we have a baby and his age is 2 months. We have to put him in prone position. Prone position is the most important things we have to do with the baby for preventing those disease. How can we do it? If we put the baby in prone position, we can prevent plagiocephaly. Plagiocephaly is flat head syndrome. Flat head syndrome, when the baby is always in spine position, he gonna get flat head syndrome, and this will affect the face of the child. You're gonna have asymmetry in the face, and the jaw and all the face will affect it, and sometimes it associated with eye problem also. So if we put the child in prone position, we can prevent plagiocephaly. How we can prevent hypoplasia, hypoplastic of hip? We can prevent it because when we put the child in prone position, the child will gonna have contraction of the muscle. So with the contraction of muscle, according to the Olfus law, always bone is grew by stress. When there is stress, the bone is grew. When we put the child in spine position, there is no weight bearing on the joint, so the joint all are free and there is no stress, so the bone is not growing. So we can prevent hypoplastic of hip by putting the child in prone position. Another important things which lead to slow physical, the primitive reflex is not retained. This will affect the child social, it interfere with the social, academic, and the motor of the child also. So we can see this child is maybe 2 months. They put him in prone position. The child will lift himself. So when he lifts himself, this will strengthen the neck muscle and it improves the hand function. Look. While the child is 2 months, you have to put him in prone position. This is plagiocephaly. The head of the child becomes flat, and this will affect the asymmetry of the face and the ear also. maybe sometime affect the reflex. One of the primitive reflex is asymmetric tonic neck reflex. If the asymmetric tonic neck reflex is retained above 1 year old, this can lead to some possibly it can have the child get scoliosis, poor handwriting, difficulty expressing idea and writing, and difficulty with eye tracking, and therefore it takes a lot of effort to concentrate, and also it can have associated with sensory system, auditory, vestibular, and visual, and proprioception also. So maybe in the beginning the child does not like prone position, but when you realize that in prone position he can do a lot of things, he can shift weight from side to side, it gonna improve the fine motor of the hands. So you have to persist on that to remain the child in prone position. Thank you.